I want to introduce our listeners to an amazing individual, Brenda Mitchell. We're in Brenda's home today. Brenda, thank you for having us here.
You're welcome.
And we're here to talk about your son, Drew, and to share about some of the challenges he had in his life, which was far too short, and to share about your own strength. And we're here to educate people around the challenges of homelessness and mental health and addiction. But first, Brenda, I just want to say thank you. I am so impressed with you and so honored just to be here with you today.
Well, thank you very much. I appreciate your coming here, and I hope that something that I say will move people to understand the challenges of the people that are mentally ill and are eventually, in a lot of cases, homeless.
Brenda, can you share about your son, Drew, and what he was like?
Sure. Drew was an amazing individual, very bright young man, always had a smile, very good-looking guy, if I say so myself.
I agree. I'm looking at his picture right here.
Yeah, from the time he was really young, he was always very active. Actually, he was diagnosed ADHD when he was in kindergarten, and he was actually kicked out of preschool for being too active, not settling down, not being situated when they were doing their classroom functions. He was also a tremendous athlete, but the one thing that Drew became very interested in at a very young age was music. He taught himself how to, he got a guitar at the age of 14, and he taught himself how to play just by listening. He was always interested in music and the different guitar players. So he taught himself how to play, and eventually was playing all the songs, copying all the songs, and then starting up doing his own music. And then after a couple years went by, he, from playing in the band, he started to feel like he needed to be more in control of what his future was with regard to the music. He didn't really want to stay with the band.
Okay.
He wanted to have more freedom to do his own thing. So he decided to go to LA. And unfortunately, the struggles with Drew started when he was younger, like in high school, is when he started into, the drug and alcohol with the music. I mean, it kind of went along with the music industry, like you got to be cool and smoke pot and
part of it, right?
And drink and whatever. And he just didn't realize that his susceptibility to addiction was really high.
And that's something that we really want our listeners and our viewers today to understand, that if they see somebody who is on our streets, who they think might be experiencing homelessness, who appears maybe to be struggling with mental health, who they think maybe they even see him drinking a bottle of alcohol on the street, right? That these things aren't always a matter of choice. And when it comes to mental health and addiction, they're scientifically proven to be hereditary. And somebody may do a little drinking, do a little smoking in high school as a part of a band, and that's it. But for somebody else, it can end up very differently.
And one of the biggest problems with mental illness is the person doesn't always want to agree that they have mental illness and get the treatment, because there's such a negative social stigma about mental illness. It's like, I'm not going to have that. I'm going to ignore that. I'm going to deny it until,
Makes it harder for somebody to actually engage in treatment. And
exactly.
Then even the other difficult reality is that when somebody does want to engage in treatment, if they're without housing and they don't have the means, that treatment may not be available. That place for them to go may not be available.
That's one of the biggest issues I find, is the place available for the people who are trying to get treatment it's very difficult to find, and it's extremely expensive.
What resources, what kind of things do you wish were more available for people like Drew?
Well, initially, a person goes, in Drew's circumstances, he was 5150 put into the hospital, which is because you are a harm to yourself or others. And he knew that he needed to be there and to get the help that he needed. So he did go. He did get his diagnosis of, at the time, it was schizoaffective disorder. and he did get the medications. And then within a relatively short period of time, sometimes within 72 hours, they stabilize you and then they release you.
It's almost always what happens, and it can very frequently happen in less than 72 hours.
Yes, it can. But initially, I think in the initial stages, when a person is newly diagnosed, they keep them a little bit longer. And they can extend it up to a couple weeks time frame if it's obvious that they still need help.
Yeah.
They technically shouldn't be releasing them if they don't have a place to go. If they have a place to live, then they let them go. But if they don't, they have to keep them a little bit longer, but that's a relatively new scenario. So they let you, when they do discharge, they let you go with a 10-day supply of medications and a new prescription, or not even a new prescription, but a referral to a psychiatrist who may or may not be available within 10 days.
Who the individual may or may not be in a state of mind to be able to get a hold of.
Exactly. Yeah. And then they say, good luck.
Yeah.
So what I would want to have happen is that they would have a place to go to get some type of care afterwards, because all medications don't work the same for everybody. So you might initially get the medication and it brings you off or down from your existing symptoms, but soon after, other symptoms start to come up and it might not be the best fit for you, but now you're out of the hospital and what are you supposed to do? So it would be good for them to be able to go someplace to get that extra care, and somebody follow you through with maybe prescribe a different kind of medication or add a different medication to the mix so that it helps. Drew left, and the medications that he was taking prevented him from being able to do his job. He was so tired.
Yeah, they have
but there was
significant
no way,
side effects.
They definitely do. So he had no way of doing a job, so then he goes off the meds to go do the job. And
it's a vicious
cycle. And
we operate a recuperative care center, as you know, and our teams there are a combination of medical staff, social work staff, and social workers specializing in connecting with disability income if somebody's unable to work, or housing options if they need housing, and clinical behavioral health staff. And so these three disciplines all work together to address the complexities of individuals in these situations coming directly out of hospitals who are experiencing homelessness with mental health challenges and addiction. One of the other things that we do is we help enter people into treatment, but then we also connect with medication-assisted treatment, which is a very somewhat new resource that we have in our toolbox to actually eliminate the brain's ability to respond in the ways that we want to drugs and alcohol. And it's an evidence-based model that can have really long-term positive outcomes. And you're no stranger to this, because I was asking you about medication-assisted treatment, and you shared that was something that Drew explored, but there was no place for him to be at that time.
No.
And Brenda, I share all of this because I want our listeners to understand that some of these places exist, but there aren't enough of them. But you're working and you're really engaging your community members, our community members, in opportunities to give and support and create more places like this.
That's my goal, is to make people more aware that there are not places that available for people like Drew, and that homeless people and people with mental illness are people. They are family members. They're our loved ones that are out there. I mean, sometimes I've been told, why didn't you help more? You do help more, but the reactions that you get as a parent are a lot different, I think, than a professional service that could help them. I think they give. There's always a history with a child and a parent and a child. I mean, you can help as much as you can, but then the relationship changes and their reaction to what you want to do to help them may not be what they think they need. If you start talking to them about mental illness and they're not ready to accept that, which most kids, especially people that are in their 20s, no one wants to be labeled as someone with mental illness when they know as well as we do how other people perceive them. So it's a difficult situation when you're trying to explain to them what's happening to them, and they don't want to listen to you. So they aren't going to be open to the suggestions that you make or to the help that you might want to provide. So you keep going, you just keep coming back and repeating the same thing. It's almost like the definition of insanity itself. You keep doing the same thing over and over and expect a different result, and it doesn't happen.
And yet here you are today doing something different.
I'm trying.
You're sharing.
I'm trying it. I feel like I don't feel that anybody who has children, like I have 2 boys that were wonderful kids, and this happened to both of them. I can't sit back and say, oh, poor me, this is what happened to me. And I don't look at it as poor me. I look at it as this is a call to action. I need to do something to help other people so they don't have to go through this experience that I have gone through, and I'm still going through. I still can't believe that Drew is gone. It's just incredible, because he was such a big, person.
Yeah. I feel like he's here with us today, and we are all about action with what we do. And on this podcast, we always provide our listeners with actions that they can do. I have some in mind from our conversation, but what would you ask that people do? They've heard this story. They've connected with you a little bit today. They want to make a difference.
Well, an interesting thing that I heard from a homeless person was, no longer homeless, but when you see a homeless person often, and I am guilty of this myself, it's you walk down the street and you see a homeless person and you look away and you feel embarrassed, as Phil Collins used to say in his song. If you recognize them, acknowledge them, say hello, you don't have to give them money. Just the acknowledgement that they're also a human being is a big deal to them.
It
is. And the other thing I just wanted to say was getting involved is something that will make you feel really good to do that. And sitting back in your castle at home and not getting involved and then criticizing the people that are trying to do something, like people in the city that are, racking their brains trying to figure out the best solution for the city to get the homeless people off the streets, not only for the homeless people, but for the businesses that it affects. It affects all of us. It's not just about homeless people. It's about every single one of us and our responsibility to others as human beings. And I feel that people need to get involved, educate themselves before they make comments about statistics of homeless people and how many of them are coming from someplace else. They're from here. Wherever they are now, they're here.
And we operate outreach teams that work on the streets here in Carlsbad, up the road in Oceanside, inland in Escondido. And we have the data to back it up that 80-90% of our neighbors experiencing homelessness are our neighbors. Right. Their last place of residence was right here. Their families are here. They work here. They live here. Your comment is so in line with every person we've had on this program, about most of them having overcome or experienced homelessness themselves. And it's a simple request to be treated like a human being, to be treated with dignity. And so I appreciate and I want to share with you the importance of what you just asked our listeners to do. And then you're doing something else too. You're actually raising money to create more places for people to go.
Yes, I am. I had been a part of in a spectator scenario with Friends of La Posada here in the North County. And Friends of La Posada is a totally all volunteer nonprofit organization. And our goal is to help the homeless through advocacy, education, and fundraising. So one of the things that we're doing is a golf tournament, and it is in the first annual Andrew Salazar Memorial Golf Tournament. It's being held at Loma Santa Fe Executive Golf Course, July 16th. And we are doing a tremendous job so far of fundraising. And
that's wonderful.
Our players, we have a great number of players, and we're really hoping that the tournament ends up being, which I think it will already, be a tremendous success. And the money will go towards not only Friends of La Posada and their shelter, La Posada de Guadalupe in Carlsbad, but will also be shared with Interfaith Community Services for their Abraham and Lillian Turk Recuperative Care Center in Escondido, which is what I feel would have been something that could have helped save Andrew's life.
Brenda, thank you so much for who you are. Is there anything else you want to share with our listeners before we wrap up?
Yeah. I want to share Drew. That's him.
Such a beautiful smile. Here's to Drew.
Well, thank you very much. I appreciate everything that you are doing, and I look forward to more fundraising and more education and awareness of our communities to our homeless and mentally ill issues.
Thank you. Thank you, Brenda.
You're welcome.